In this episode of the Dr. Clay Show, I'm going to show you how you can figure out if you are upper back dominant versus lat dominant, and that will enable you to fine-tune your back development. Good morning, good afternoon, or good evening, or buenos dias, buenas tardes, or buenas noches, whichever one of those six applies. Welcome to it's a spur of the moment episode of the Dr. Clay Show. How to figure out if you are upper back dominant versus lat dominant. Now, I've written about this only once, and that was in an article for tnation.com, and I think it was building a bodybuilder back or something like that. No, the upper back, when I say upper back, what I'm talking about is predominantly the area around, or actually more specifically between the shoulder blades. So you could say interscapular, as in between the shoulder blades. So we're talking about the trapezius for one. We tend to think of the traps as just being up here, this part at the top, and that is your traps, but that is region one of your traps. And your trapezius has 3 to 4 regions depending on which textbook you read. Most say 3, by the way. Upper traps, then middle traps, and then the lower traps. And that makes sense, as those are 3 functionally different regions. So when we say upper back, we're talking about the mid and lower trapezius, as well as the rhomboids that lie underneath. And then arguably, when we're talking about back or upper back thickness, we're also talking to an extent about the muscles even deeper to the rhomboids, and that is the spinal erectors, the erector spinae, as they go from the sacrum, the iliac crest, on up. But in fact, the erector spinae, we tend to think of it as just being in this low back region, but in fact, the spinal erectors are also present up in your upper back and deep to the rhomboid. So spinal erectors do contribute thickness to the upper back region. So then, of course, when I talk about being lat dominant, I'm talking about the latissimus dorsi here that's on the lateral aspect that gives you that V taper. Okay, so with that in mind, how do we figure out if you are upper back versus lat dominant? The way you can tell is someone who is upper back dominant, you can look at their upper traps, and this is kind of, again, it's a tendency. It's not like it's just cut and dry. People don't fall into one category. If this is upper back dominant and this is lat dominant, everyone it tends to be on somewhere on that continuum or somewhere on that spectrum. But nonetheless, people that are upper back dominant, they tend to have big upper traps, and they tend to have smaller, often thinner lats, and sometimes narrower shoulders as well. So their development is much more in the upper back as compared to the lats. But I would say the thing that jumps out the most is the upper trap dominance. So what happens when someone who is upper back dominant, and this is how you can tell, if you can't visually assess your physique and tell, then here's what I recommend doing. And this is the example that I gave in T-Nation, is to hook up to a low cable rope. You know, hook the parallel grip handle up to the low cable rope and do a set, you know, a nice heavy set of 12, 15 reps. And do the set, take it to failure, and then assess as you're doing it, and at the end, assess whether or not you feel it more in your upper back or do you feel it more in your lats. Now, for you lat dominant people like myself, you will feel it more in your lats. It's like even when I'm just going through the motions of doing this, I can feel my lats almost pump up. You know, I can really feel them contracting. But yet I really have to focus and think about my upper back, this mid and lower trapezius, as well as the rhomboids. I really have to focus. It's hard for me to tap into those areas, whereas it's easy for me to tap into the lats. Whereas if you're upper back dominant, then when you're doing low cable rows, you will feel it more in your upper back, and you'll tend to pump up. You'll get a pump to kind of feel the work more in the area like around your shoulder blades. So that's how you can tell. And the physiology behind this is this: when you are upper back dominant and you have more development, more hypertrophy in that region, then you likewise, and this is my theory, but I'm sold on the fact that it is accurate, not just a theory, but no studies have been conclusively done to prove it. Nonetheless, here it is that area has a much better neuromuscular efficiency as compared to the lats. So if you have better neuromuscular efficiency, that means the ability to contract, to activate and contract more muscle fibers in a certain region, then it's going to, you're going to contract it easier, but you're also going to feel it better. And then likewise, because you can feel it better, and specifically because you're activating more motor units, more muscle fibers, you end up with more development there. So it's like, it's sort of a snowball effect. If you're upper back dominant and you keep training, you end up more upper back dominant, unless you address it, of course. So it's the improved neuromuscular efficiency over one region versus the other. So I'm lat dominant, so anything I do, my lats, it's easy for them to contract. They contract, just at the drop of a hat, so to speak. Whereas my upper back, it's like, oh, what, you wanted me to do something? Oh man, you caught me snoozing. That's how my upper back is, and that's why, from a bodybuilding standpoint, I'm too thin from the side. So, I'm a little thicker here. I'm by no means thick, period. See, I'm more wide, and it's this type of frame, by the way, that lends itself, in my experience and seeing this observationally, to being lat dominant, whereas people that tend to be narrower and have narrower clavicle, so to speak, or the distance between the acromion, the AC joint, is smaller, those people tend to be a bit more upper back dominant. That I'm not sure why that is, but it correlates to better neuromuscular efficiency in that region. So, in summary, if you are upper back dominant, then you will have more development, more hypertrophy in this area, the rhomboids, middle and lower, and even upper traps. And when you do most back exercises, like for example a low cable row, you'll feel it more in your upper back than your traps. And then people that are lat dominant, who tend to be wider, maybe thinner, well, typically thinner and wider in appearance, if they are lat dominant, then doing exercises like that, it's hard to wake up the upper back, hard to feel it, but easy to tap into the lats. So what you need to do to correct that, assuming you want a balanced looking physique, what you need to do is, one, recognize which one you are. Are you upper back dominant or are you lat dominant? And then adjust your training accordingly. So for me, being lat dominant, I need to do things to wake up, so to speak, my upper back. Because like I said, it's snoozing. So I need to give it some caffeine or something. But you do that, and essentially the way you do that is to improve the neuromuscular efficiency in that region. So I should be doing exercises to target that region, and arguably doing them more often, like doing a little rehab type exercise for the upper back, maybe every day, as long as it's not too taxing. Bent over flies, maybe pull downs behind the neck, do those lightly, use caution with those, by the way, etc. Things that target the upper back, in particular rowing motions with your arms abducted. That puts the lats in a more stretched position, in a less mechanically favorable position when you abduct the humerus. Therefore, the brunt of the work and the brunt of the stress is placed on these upper back muscles, the traps and rhomboids. Likewise, those of you that are upper back dominant, you should do more of your work with your humerus adducted. so that therefore you put the lats in a mechanically favorable position to do more work. That, and also get you a nice arch to accentuate the contraction of your lats. And then maybe if you're upper back dominant, maybe you can do some rehab stuff, so to speak, for your lats to kind of wake them up. Something like if you have access to a gym a good bit, a straight arm cable pull down. Maybe do something like that, 3 sets, 5 or 6 days a week, and that'll help to wake up your sleepy lats. All right, my friend, that's going to wrap it up for this spur of the moment experimental episode of the Dr. Clay Show. And I hope this little bit of information helps you to fine-tune your back training and helps you ultimately to improve your back so that it looks like you want it to. Anyway, my friend, take care, and I will see you soon.